If you're a mom sitting on your couch or maybe laying at 2 a.m., 3 a.m., or maybe even noon, staring at your baby, panicking and wondering if he or she just got enough milk because you can't see it and you're breastfeeding, do not panic. This video is for you. Remember, you are not failing your child. In this video, I'll walk you through 3 secret, highly accurate ways to know that your baby is getting enough milk, enough breast milk. So let's go. Hello and welcome to the Dr. Amaka Nnamani Show. I am Dr. Amaka Nnamani, a pediatrician, a board-certified pediatrician, and a mom of 3. I've been where you are, and I hope that at the end of this video, you'll feel confident and know that you are the best mom for your baby. So let's start off with what may be the problem. Right? You're breastfeeding. Everyone said breast milk is best for your baby, but you're not sure what you're doing. You're not sure, how do I know that my baby's getting enough? My breasts are not transparent, so certainly I can't see, right? Let's talk about those things that you should be looking out for to make sure that your baby is getting enough milk. Number 1 is it's really important to know that your baby's tummy is really small at birth, right? So the first milk that your body makes, it's called colostrum. It's a very thick yellowish milk that is very high in its immune content. In fact, we call it liquid gold because that's exactly what it is. It's really the first it's like the first vaccine that your baby gets, right? And so on day 1, your baby's tummy is almost as little as a cherry or a marble. So that means that your baby's tummy can hold just about 5 to 7 milliliters of milk. So do not fret when you feel like, oh, I'm not engorged and I just had a baby. You're not supposed to be engorged. Actually, your body starts to, you start feeling the fullness in your breast right around days 3 to 4. That is when most moms begin to feel that tinge in their breast, that their breasts are beginning to get full. So always remember that you are not failing your baby or yourself, and your baby's tummy continues to increase over the course of time. Now, as your baby gets older, their tummy gets bigger, right? And so that leads me to number 2 is your diaper count of your baby. So you're normally able to tell if your baby is getting enough milk by the number of diapers your baby is making, right? So, but on day 1, your baby's making about 1 to 2 wet diapers, right? Your baby's probably still in the hospital, and your baby will actually your baby will not get discharged if they haven't passed urine or peed prior to discharge. The other thing, as an aside, is that your baby needs to have pooped, before discharge. And most babies would have pooped in the first 24 hours of life, right? So day 1, your baby's making about 1 to 2 wet diapers. Day 2, about 2 to 3. Day 3, about 3 to 4. And by day 5, most babies are making at least 5 wet diapers. And a lot of times it's more, and they're usually pretty heavy sized diapers. Okay. Also, the color of the poop is a good way for you to know that your baby is making good milk, right? So in those first 3 days or so, your baby's poop is usually like black, sticky, and we call it meconium. So they're trying to get rid of all of that stuff from their bodies, right, in the first few days of life. And by day 5, your baby's poop should be soft and usually actually runny, and it's not a diarrhea, but it's importantly what we call yellow seedy, or almost like a mustard yellow. If you're in the US, you may be able to relate to this more, where the color of your baby's poop is about a mustard yellow, right? And so that's a really good way to let yourself know that, yes, my baby is getting enough milk. Now, the other way, you really want to remember that most babies will breastfeed 8 to 12 times in a 24-hour period. In fact, I write about this in my book, Ziora's Quest, Mommy's Milk Rocks, and we'll read an exact excerpt from that. And it says, did you know that a newborn baby breastfeeds 10 to 12 times a day? That's a lot. And that's because the milk is very easily digestible. Breast milk is so easily digestible. So within an hour or 2 hours, they're ready for more milk. So if your baby is wanting to feed several times, that is actually a good sign for you that you're doing your job. Your breasts will also begin to feel softer after you've emptied them, right? So before, a lot of times, at least from days 3 to 4 onwards, your fullness is a sign that you probably need to empty your breasts and feed your baby, or pump if you're choosing to exclusively pump and not nurse, or if you're doing a mixture of both. So that softness that you feel after you've breastfed your baby is actually a good sign. Now, one that I really enjoy, a sign that I really like to talk about, is the fact that it's actually the way your baby looks, right? So first of all, you want to hear the sounds that your baby, the gulp, right? So a lot of babies, when they're nursing, you will actually, especially from days 3 on, you will hear the sound of them swallowing. So that's something you want to look out for. And then there is what we call, the milk drunk baby. And I absolutely love that. It's really when you see your baby's body is like almost, I don't want to say limp, but almost, right? So they're so relaxed. Relaxed is a better term to use. And their fists are unclenched or open, because really in those first few weeks of life, their fists are usually mostly clenched. But as your baby gets full, their fists kind of open up, and it's such a reassuring sign for you. And then they almost leave their mouths agape, like open, and they pass out. When I say pass out, they're like just content, right? So these are really important signs for you to look out for, to make sure that your baby is it's getting enough milk. So no, you don't need a pump if you choose not to. These are very important signs for you to know that your baby is getting fed. Now, some warning signs are, one, if your baby is making less than 5 diapers and by day 5 or day 6, if your baby is really too sleepy to want to wake up and feed, that is usually not a good sign. Now, babies are usually very sleepy in their first few days of life, but a baby who is not alert enough to want to feed is usually not a good sign. Now, another sign we want to look out for is jaundice. And jaundice is when you usually have like yellowing of the skin or the eyes. Now, in babies of color, jaundice might look slightly different versus in Caucasian babies. So you usually want to, a lot of times, most babies that are jaundiced will also usually have yellowing of their eyes. So you want to check for that, knowing actually that the jaundice of the eyes is usually the last part of jaundice to go away. So that these are reasons for you to see your pediatrician, and your pediatrician, depending on where your baby falls in the chart, which is really dependent on how old your baby is by the hours of life, and their bilirubin level. So we will usually draw blood, which can be just like a heel stick, to let us know what your baby's bilirubin level is, and if your baby needs like phototherapy or lights, or just close follow-up. So these are things that you really want to be looking out for. So we've talked about quite a lot here. We've talked about remembering that colostrum is really one of the it's the first milk your body makes, and it's probably one of the most important parts of breast milk, right? But it's thick, it's high in its quality, but not as liquidy, not so much in quantity, right? So it's the first milk that your body makes, and usually the size of your baby's tummy gets bigger as the days go by, starting off with as little as about 5 to 7 milliliters a day can handle at a time. Your baby, for a breastfed baby, will feed about 8 to 12 times a day. Most babies go in about 10 to 12 times, because you really want to be able to stimulate your body so that your body makes more milk. Okay, and then your diaper count, remembering that day 1 is about 1 to 2, day 2 is about 2 to 3 wet diapers, day 3 is about 3 to 4 wet diapers, and after day 5, your baby usually will make at least 5 wet diapers. We also talked about the color of the stool. We talked about the way your breasts feel after you've emptied it. And we talked about what your baby looks like when your baby is done feeding. Remembering that your baby gives you several cues before to show that they're hungry, with the first being rooting, which is that, and crying usually being the last sign of hunger. So I hope this video has been really helpful for you. This will be a series by popular demand, so be sure to like, subscribe, and share with a mom or moms in your life that you know this would be helpful for. And until the next time, remember, preparation over perfection. You are the best mom for your baby. And so until the next one, toodles. Bye.